Faced with growing pressure from business leaders and from the trades unions, the Chancellor is set to announce new measures tomorrow to protect millions of jobs in the months ahead. The current furlough scheme, which has involved the government paying up to 80% of salaries, is due to be phased out at the end of October. And Mr Sunak is now said to be considering different forms of wage subsidy and is expected to announce more financial help. As new restrictions come into force to contain the pandemic, the Treasury announced that it wasn't appropriate to have an autumn budget this year. Our chief political correspondent, Vicki Young, picks up the story.
Welcome to Eden Court. We're Scotland's largest single-site arts venue. As you can see, we're closed, but we want to be open.
Across the country, businesses are struggling. The seats in this theatre are empty and could stay that way for months. James says they're having difficulty paying the bills. Most of the wages are being covered by the furlough scheme.
There will be a tsunami of job losses across the performing arts, with the furlough scheme coming to an end and without the ability for us to return to live performance in a meaningful way.
The government's already spent £40 billion supporting millions of jobs, but says that scheme won't be extended.
Are you letting businesses down, Prime Minister?
It doesn't want to pay people for jobs that have no long-term future. But the pressure's been mounting to come up with an alternative.
He's phasing in health measures, restrictions which we do support, but at the same time he's phasing out economic support. Health measures and economic measures are now dangerously out of sync.
Prime Minister.
The Prime Minister acknowledged the difficulties faced by business.
These are indeed tough times, and I have no doubt that many businesses, many employees are feeling a great deal of anxiety and uncertainty, and we will do our level best to protect them throughout this period.
And promised more action.
We will go forward with further creative and imaginative schemes to keep our economy moving.
Scotland's First Minister has already announced tighter coronavirus restrictions than in England.
There is an argument that all of us across the UK should actually be doing even more right now. And there is a danger that what starts to hold us back is not the public health analysis, but financial limitations.
The furlough scheme will end in 6 weeks' time, a cliff edge, say business leaders.
We don't think there needs to be a blanket extension of furlough, but this is an emergency moment for firms where there needs to be some additional support in place to protect jobs. And actually, it needs to come in very, very quickly because firms are making people redundant, literally, as we speak.
The Chancellor has been listening and will give more details to MPs tomorrow. But the huge economic uncertainty has forced him to cancel this year's budget. Coronavirus restrictions are now going to be with us for many more months, and the Chancellor's been under huge pressure to extend the help he's already given to businesses. And tomorrow he's going to do just that. It's understood he's looking at wage subsidy schemes, topping up the salaries of those in industries that have been struggling. A Treasury source said his priority has always been people's jobs. The hospitality and leisure sectors are facing a bleak few months. Those who work in them will be desperate to hear whether the Chancellor's plan will be enough to keep them in a job. Vicki Young, BBC News, Westminster.
Well, with me is our economics editor, Faisal Islam. Can we talk about this cancelled budget? Some people may just assume that it's one of those things that just needs to be put off for a while because of all the crisis that they're dealing with. What should be read into it?
I think it's a big deal because of what it tells us about the big picture here. The autumn budget was planned to be the launch of the kind of medium-term strategy for the government. It's levelling up agenda, spending more on big infrastructure projects around the country, but also in repairing the public finances, getting the debts down from the extent to which they have ballooned so far. The tough decisions, if you like, those tough decisions have been parked, at least for a few months, whereas they're going to spend more on extra help for jobs. Because, and this is what this reveals, we're still in crisis mode because of what's happening with the virus, because of the backlash from some in the business community about the extra restrictions announced yesterday. One leading restaurant entrepreneur, Julian Metcalfe, founder of Pret a Manger, saying that it was absolute nonsense, this 6-month sense of extra restrictions. So I think you get a picture of a Chancellor that wants to carry on with the rescue, park some of the tough decisions about, for example, tax rises, and focus on jobs.
Faisal, many thanks again. Faisal Islam there, our economics editor. Well, now let's have a look at the latest government figures, which show a big rise in new cases of coronavirus in the past 24 hours. 6,178 new infections have been recorded across the UK. It means that the average number of new cases reported per day in the past week is now 4,501. And an average of 262 people were admitted to hospital each day over the past week. This number does not include Scotland. In the past 24 hours, 37 deaths were recorded of people who died within 28 days of a positive COVID-19 test. It means on average in the past week, 25 deaths were announced every day in this context, and that takes the total number of deaths across the UK to 41,862. Now, there's been a major outbreak of COVID-19 at Glasgow University after 124 students tested positive for the virus. The clusters are centred on 2 halls of residence in the city, and 600 people are now self-isolating. The university said that the actual number of infected students was likely to be higher. Tighter restrictions, including curfews for the hospitality industry, have been announced for each of the 4 home nations, but those restrictions also include some significant differences, as we've been reporting in recent days. In Scotland and Northern Ireland, people can no longer meet with other households indoors, while England and Wales have not gone that far. So what is the scientific thinking behind those decisions? Our medical editor, Fergus Walsh, explains.
The morning after lockdown was declared, central London was deserted. The total shutdown brought the virus under control, but devastated the economy. Today, with coronavirus cases rising, we are all facing new restrictions. But even the toughest are nothing like the first lockdown, when there were fears the NHS would be overwhelmed. When the national lockdown was introduced on the 23rd of March, deaths were averaging 200 per day. The virus was out of control. Deaths continued to rise for a while, peaking in early April at 1,000 patients a day. But lockdown soon had a dramatic effect. Deaths fell rapidly and continued to decline even as lockdown restrictions were eased from May onwards. Deaths have begun to rise again, but from a low level. Ultimately, controlling coronavirus will depend on enough of us abiding by the new rules, whether here in London or anywhere else.
10 p.m. curfew is really going to have issues for us younger generation, because we like to go out, and obviously this is ruining our university lifestyle as well, which is meant to be like an experience for us. So
if they're going to have a lockdown, they should just have a full lockdown like before and try and get things under control.
Around 1 in 5 people in the UK, 14 million people, are already subject to extra local measures. None of these comes close to a total lockdown, and there is mixed evidence on how well they've worked. Oldham in Greater Manchester saw a surge in coronavirus cases from early July. So at the end of that month, local restrictions were introduced. People were not allowed to meet in each other's homes or gardens, but pubs, shops and restaurants remained open. Cases did initially fall, but despite rules being further tightened, the trend has generally been upwards. Some of those tracking the epidemic think only a second lockdown will work.
We need to apply a series of measures, and it would be a short, sharp lockdown, potentially closing the pubs, greatly limiting household mixing, the rule of 6 being made more strict, possibly just going back to the single household member mixing for social and psychological support.
But another lockdown would further damage the economy and risk other health consequences through rising unemployment and poverty. There are no easy choices for ministers.
Fergus is with me. Let's start with the sharp rise in cases. And when you look at the factors involved in that, what kind of guidance would you be able to give viewers on that picture?
Well, what's clear, Huw, is that we are actually going to have to learn to live with coronavirus this winter. Scientists accept that we cannot suppress it completely. So that means some level of deaths, sadly, is inevitable, just as there are every winter with flu and pneumonia, two infections which currently kill more people than COVID-19. But of course, COVID-19 has also left thousands of people with long-term health problems that we're only just beginning to understand. Now, the dynamics of the virus and how it spreads haven't changed, which is why the central messages on social distancing and hand hygiene mustn't be forgotten, as well as having enough tests for those who need them.
And during the day, as you've been keeping tabs on all the story, there's some news on the vaccine front.
Yep, the UK could become the first country in the world to conduct so-called challenge trials. Now, this is where young, fit, healthy volunteers are immunised with a coronavirus vaccine, and then a few weeks later, they're deliberately infected with coronavirus. Now, that tells you very quickly whether that vaccine works, and it can speed up the selection of the best vaccines. Now, the safety of those would-be volunteers, and there are loads of them, I've met some of them, will be paramount. They'll be monitored 24/7 at a research facility in London, and one of the teams that hopes to be involved said tonight they hope those trials could begin as early as January.
OK, Fergus, once again, many thanks. Fergus Walsh, our medical editor, with the latest on today's events.